so much for joining today's NeedyMeds special topic webinar, RX Outreach, Making Medications Affordable. My name is Carla. I'm the Director of User Engagement at NeedyMeds. And before we get started, I'm going to offer a few tips so you can make the most out of today's presentation. First of all, if you do have questions, you can type them into that questions section, or for some of you, it may be the chat section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't have the chance to answer your question, we will follow up with you by email. But of course, we'll provide the contact information for both RX Outreach and NeedyMeds at the end. Also, this webinar is being recorded and will be uploaded to the NeedyMeds YouTube channel. And as you saw on the previous screen, or actually 2 screens ago, we did upload some materials into that handout section of your GoToWebinar control panel. You'll find both our PowerPoint slide decks and other information from our organization. Again, we thought our organizations, plural, that we thought you'd be interested in. Okay, so let's get started. Really quickly, I'd just like to cover what NeedyMeds is for those of you not familiar with us. We are a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Rich Sagel, and his friend, Libby Overly, who was a medical social worker. On your screen is the NeedyMeds mission statement, but simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that completely free and completely anonymously through our helpline, 1-800-503-6897, and our website, needymeds.org. And I always like to put up a screenshot of our homepage because our website really is the face of our organization, and it gives me an opportunity to point out just a few resources, such as if you are looking for healthcare savings resources, you can check those out under the aptly named Healthcare Savings tab. I did mention that this webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can find that on the top right of our homepage with the rest of the social media icons. It's the third one from the left. Also, I wanted to point out that if you are interested in checking out and registering for other upcoming webinars, you can find those on the calendar of events, where that red box that just popped up is on the bottom right hand of needymeds.org. So let's get into why everybody is here today. As you saw a couple of slides ago when our mission statement was up on the screen, a big part of our mission is educating people. And of course, we define that by educating people about NeedyMeds and the resources we offer, but also by letting them know about other ways to save on their healthcare expenses, which is why we are so pleased to have our guest, Bill Vatterott from RX Outreach, here with us today. So first, let me tell you a little bit about RX Outreach. They are the nation's largest nonprofit, fully licensed digital pharmacy. They offer more than 1,000 medication strengths at affordable prices. Mission to provide affordable medication to the underserved, RX Outreach partners with hundreds of clinics and organizations across the U.S. to provide a crucial health safety net for those who battle both illness and poverty. Now, I'm going to tell you some statistics and some numbers here that Bill might actually update us on a little bit later on. But what I'm showing is that since 2010, RX Outreach has served over 420,000 people and helped them save more than $822 million on their prescription medications compared to retail costs. And those numbers always blow me away. Excuse me, one sec. I don't know if anybody else suffers from winter allergies, but that's what I've got going on here. Excuse me. So now let me tell you a little bit about our guest today, my friend and colleague Bill, the marketing manager at RX Outreach. Now, what I always say when I introduce Bill is that title doesn't quite cover the extent of what he does or his passion for helping people. Bill has worked in nonprofit organizations for over 25 years, including the last 5.5, but I think we might be hedging in on 6, Bill, at RX Outreach. He graduated from Catholic University in Washington, D.C., and later earned a master's degree in theology and divinity from Kendrick School of Theology. He also recently completed his doctoral work and passed the comps in educational leadership at St. Louis University. So, both his professional and academic experience speak to his dedication to helping people and making a difference in their lives. And we're so proud and pleased to have his partnership and are so grateful he's taking the time to share his expertise with the NeedyMeds audience. So, without further ado, I'm going to go ahead and pass the mic and the screen to Bill. And as he grabs that and opens up his PowerPoint slide deck, I will remind everybody that if you do have questions, you can go ahead and ask them at any time by typing them into the questions section of that GoToWebinar control panel. With that, I'm going to pass the mic to Bill. Enjoy the presentation. Thanks for joining us.
Good afternoon or good morning if you are on our West Coast. Thanks, Carla, for the kind introduction, and thank you for being here this afternoon. I like to say that the point of any nonprofit organization should be not to exist, because the reason for your existence is solved. Obviously, there's still a great need for affordable medication. That need is still unmet. That's why you're here. So whether you're from a clinic or doctor's office, a community organization or disease state organization, or if you're a caretaker, an advocate, or a patient, welcome. Thank you for being here. I want you to have a firm understanding of RX Outreach by the time we finish up, and I want you to know what we can provide for you and the people you serve. So we got a letter a few months ago from one of our patients. I thought we'd start off here. Just a little background. Our staff sends handwritten condolence cards, sympathy cards to patients' families when the patient passes. This note was from an existing patient after her husband, who is also a patient, passed away. So she just said, "Thank you, dear RX Outreach. Thank you so much for the sympathy card you sent, the beautiful card, and even more, the beautiful words meant the world to me. Things have gotten very quiet around here after the hectic time when her husband passed away on May 26th. I was feeling a little adrift when suddenly your card appeared. What a nice unexpected surprise." And this is what I wanted to share with you and highlight. I have to tell you, you're directly responsible for a few of the extra years we had together. There was no way we could have afforded full price for his meds. So I want to thank you very much for affordable meds. The words on the top of your prescription bottle pretty much say it all: honoring God by serving others. May God bless you, each and every one. You have really touched my heart. Thank you. This is just one of the wonderful cards, the feedback that we get from our patients. The number one question that we get after, I should say the number two question, because the number one question is, do you carry insulin? The answer is no, I'm sorry, not yet. The second question is, are you for real? RX Outreach is a remarkable organization that not a whole lot of people outside the healthcare safety net know about. So I'm glad you're here today, and hope that you hear something that will inspire you, not just to join RX Outreach, but to share it with your neighbors in need. So RX Outreach is, as Carla said, the country's largest and only nonprofit digital pharmacy. Our mission is to provide affordable medications to people in need, and our vision is a world where everyone has access to the medications we need. And I like to think kind of from a clinical level, that what we ultimately do, and as that patient's letter highlighted, we improve people's lives. We give them a better health. We can help them have a longer life, a quality of life that is better because of the access that they have to medications. RX Outreach is patient focused, we're transparent, we're convenient, and we're a sustainable service. And I'm going to kind of get through, highlight each of those during our presentation today. But before we go any further, let me tell you first what we don't do and what we're not. We are not here to replace anyone's current pharmacy. We see ourselves as complementary. We don't generally carry medications for acute medications. Uh, for acute conditions, we send them by mail, and so that's mostly chronic. Some people come to us for a short time because they're between jobs and they lost benefits. We don't take insurance, our so some people find that their copays get too high. Uh, and they come to us for a little while, or they have a condition, they need a medication, and then they move on. We're fine with that. We just want to make sure that everyone gets medications that they need. Our president is our new president, Julie Erickson, shared this quote with me. Besides being an important part of the healthcare safety net for the uninsured, RX Outreach helps working people save money on their medications. We believe that everyone should have access to affordable medication. And I wanted to share this with you because in the last 10 years, 11 years, RX Outreach has changed a little bit. We do have income guidelines. So for someone to qualify for our program, in the early days, the first 8 or 9 years of our organization, they had to be 300% of the federal poverty level. I'm going to get into the specific numbers of that uh, in a little bit. But we changed a few years ago to 400% to match the federal subsidy for ACA, to match a lot of the patient assistance programs. And our patients have changed a little bit. In the earlier days, it was a lot of people who did not manage their own health care. I know that we have a lot of advocates, and we generally have um, folks on this presentation that manage other people's healthcare. That was a lot of our folks at the beginning. More recently, our patients are a little more savvy. With 400%, they know the cost of the medications are going up. They've learned, thankfully, to shop around. That you shouldn't just go to the pharmacy counter and assume that that's the only price. As I said, sometimes the copay is uh, more expensive with insurance than what you can actually get the medication from, what you can get it for. So we've changed a bit, and I think some of the changes in our company that you'll hear about reflect kind of who our kind of newer patients are. So just taking a step back before we dive in, we do have a public health crisis, and that is what's called medication non-adherence. What does that mean? It essentially means that uh, 2 out of every 3 Americans with prescriptions don't actually take their medication as prescribed. Um, in fact, the CDC says only 60% of the prescriptions that are written are filled by the pharmacy. Only half are picked up, and less than 25% of those medications are taken and refilled. So why is this? It's primarily the cost, due to some patient attitudes, uh, the therapy and the complexity, and then some environmental related factors. So just very briefly, um, about 45 million Americans in I think last year, 2 years ago, did not get their medications filled because of cost. We know the costs keep going up. 80% of people say it's unreasonable. And this really affects disproportionately people that have a lot of medications. Or if they have medications that are over $100, they're more costly. If they have an income of less than $40,000 a year, or they're on a fixed income. And even though people know that it's good to take your medications, that they help, unfortunately, many Americans have to choose between buying their groceries or filling their prescription. They have to consider skipping doses. I'm going to not take this medication this month, and I'm going to get it next week, next month. splitting pills in half, all that stuff because of cost. Other factors, some people don't take it because they don't they don't think that it helps, or they may not have adverse symptoms when they miss a dose. I interviewed a patient last month, I guess, and he received a liver transplant from his mother when he was 4, saving his life. Excuse me, kidney transplant. And when he was about 17, 18, he just really stopped taking his medication, or took it only when he felt something. And that, unfortunately, that non-adherence led to uh, the need to go on dialysis again, and he ended up having, thankfully, to get another transplant. He found another donor, but he's now a great advocate for medical adherence because of that. Um, Other times people don't take it because it's difficult, maybe an inhaler or injections. They don't like the side effects. It's related to the therapy. And lastly, just the environment, access to medication. Some people live in rural parts of the country. They can't get it. They may not be able to get into a particularly mental health professional for weeks or months on end. Here in Missouri, there's one mental health provider for every 2,700 people in rural areas. And we know that the ramifications of this, of medical non-adherence, medication non-adherence, it disrupts lives, and it ends lives. So that's why it's really important just to take a step back and know why we're here, because of all these consequences. So RX Outreach, I like to think, is a solution to these issues. As we started as a nonprofit from a company called Express Scripts, now they're Cigna, and we bring a corporate efficiency and a charitable heart. And I think we're uniquely qualified to help improve the health outcomes of patients because of being our focus on patients, our transparency, the convenience, and our sustainability. So just a few stats before we get into the how-to. Um, we serve 450,000 patients. I'm going to update these next couple weeks, but 872 million now. We've saved folks. We get some donated prescriptions. We've prescribed over 3.9 million prescriptions, and we're licensed and delivered to all 50 states every day. We are fully licensed, and this is important now, especially. But these are some of our credentials, and we were named the last 2 years by Money Magazine as one of the top 5 online pharmacies. So we're the only nonprofit pharmacy listed there. So we're very proud of that. So I'm sure that many of you on our webinar today have your own stories about patients, and what it means for them when they actually can get medications and get access to healthcare professionals. So how to use RX Outreach? So RX Outreach, all patients are required to be enrolled, and that can be through a clinic, which I know some of you are from clinics or doctor's offices here. The clinics can do it, or a patient themselves, or an advocate, or a caretaker can enroll someone. And we'll get into kind of a little bit more of the details of that. Enrolling is easy. You can do it online, our website. You can call or download and mail in an application from our website. All we really need is someone's name, address, and household income. And that's because we do have the income guidelines for our program. We can take prescriptions, we e-scribe, fax, or mail. They can be transferred from other pharmacies. We actually can call the pharmacy or the doctor's office for transfers. And once a payment is made, the medications are shipped to the address of choice. So it's either a patient's home, or in some cases to a clinic for distribution. And then we do the refill reminders and renewal reminders directly to the patient. Some advocates ask that we go through them. We do that, but we do it through calls, emails, and text. So to begin, RX Outreach is patient focused. And what does this mean? Well, the people that we serve have to meet the income guidelines, and these guidelines are Um, are the only kind of barrier that we have. We don't care other about people's citizenship and insurance status. They can have insurance or not have insurance. It is the income guidelines, and um, you could see here the 2021 guidelines. Um, these usually get updated a few weeks into the new year. So by about the third week of January, we'll have the 2022. We could see a family of four up to $106,000, and that is on income. It is not assets. So a lot of our older folks that are retired, they ask about that, especially because they have other resources, but they of or medication, but oftentimes those are gone and they wonder if they can come over. As long as the income guidelines are met, then they're welcome to join our program. We actually have last year expanded these guidelines and continue to have them expanded. So if somebody has a special condition, maybe they've lost a job, have extra family due to COVID, or have extra childcare costs, or someone's been unable to work, um, we have kind of we've allowed for higher than 400% on a temporary level. It's only temporary because of our nonprofit status. We need to keep the integrity of our program. So when should someone consider RX outreach? And what I'm being tried to create this being mindful of both patients and clinics and advocates. But so generally, if someone is spending their own money on their medication, or if they've exhausted all their options for free medication, um, and affordability is necessary. So we know, for particularly clinics and patients, free comes first. We understand that, and but free runs out. Um, Sometimes things are short dated, or it's difficult with paperwork and such. So uh, RX outreach is an option then. If somebody doesn't qualify for a patient assistance program or Medicaid, so some patient assistance programs, it's 150% of the federal poverty level, or 200 or 300. So as 400, we have a larger umbrella for people. If somebody's insured, but their copays are too high, RX outreach could be an option for them. If they have multiple medications, some people do they only get one medication from us, and the others they get from their local pharmacy. If a person is medical compliance is threatened by their mobility. So because we deliver directly to someone's home, the chance that they will kind of take that medication and get theirs, it increases. Um, I had a medication to pick up at Walgreens this past week, and I drove by one time because there was 5 cars in the drive-through. Um, the next time I went, it wasn't ready. Um, and then my wife went to pick it up, and the insurance was different, and so they wanted to charge a lot more. So that took it. It ended up taking 5 or 6 days by the time I actually got the medication. So again, I'm not criticizing other local pharmacies, because we know the huge amount of work, particularly with vaccines and shots and everything that our pharmacists have and our farm techs. But RX outreach can be an option, particularly if somebody is in a place where they don't have that ability. There's a transportation barrier, or time barrier. If somebody is uh, not able to get the medication, particularly if they're going to a clinic and that strength or that they need is not there. And lastly, if they want simplicity, and I'm going to get into simplicity in a little bit, because we have no coupons, we have no discount cards, anything like that. And I think it's frustrating to some of our patients, but we keep it very simple. So in addition to being patient focused, RX Outreach does help improve it because we are transparent. We are a very transparent organization. So what you see is what you get. We have no hidden fees, as I said, and all the prices on our website include shipping. So I'll just give you an example. This is straight from our website. So all our prices or listed, and it's you can see acyclovir is $20 for 180 days. So someone can get the 6 months of medication for just $20. And at the top, you can see we can actually download one of the pages. It just shows the medications by disease state. Our entire formulary with all the pricing is downloadable as well. So we like to keep it very, very transparent for everyone. Um, Here's just an example of just the HIV meds. I checked this morning on GoodRx, and which we love to be on GoodRx. Unfortunately, it's cost prohibitive for us. We'd have to raise the price of our medications, and that's something we don't want to do. But just this top medication, this morning at Walgreens, according to GoodRx, it was $810.74. CVS $836.29, and Walmart was the winner with $216.96. So from 216, almost 217 for 30 days to 150 from us. Sometimes places that have membership, like a Sam's or Costco, that is a barrier because they have a cost for membership for a lot of folks. But our prices are generally um, 50%, 60, 70% below retail. It changes a lot, but that's generally what we are. Some of our patients, they go to their doctor, and because a doctor may not be aware of how expensive medication is, and they'll go and say, "Hey, I have I need this other muscle relaxer. This one's expensive. Will any of these work for me?" So that is uh, so we created this page. We carry medications for I think over 50 to 60 chronic conditions. So RX outreach, as I also mentioned, is convenient, and this is really important. Particularly, we found during COVID. So we are mail order, and it's more common nowadays. But we know that particularly those that are lower income, it's challenging with mobility, lack of transportation, bad weather. With the pandemic, a lot of people were quarantined last year, and still are hesitant to go out and wait in crowded places. We process our orders. If a clean script comes in, it's one day we get it. We get the medication processed. It's checked by our pharmacist, and it's sent out. We just started with a new company for shipping. So now most of our folks will get their medications within within 6 days. I think about 70 to 80% within 6 days. And so we try to kind of use different carriers. The controlled medications, which we don't carry a lot of controls, those are all tracked, and those we do overnight for an additional charge. But all our medication prices on our website include shipping. There's no other fees. Um, we don't take insurance, as I mentioned, so we take kind of all the usual forms of payment. One of the wonderful things about RX Outreach is that we do have a great call center. We're all based here in St. Louis, and our call center is open later now. We just extended our hours until 8 p.m. Central. Um, but you can always call and talk to a pharmacist. 70% of our phone calls were answered under 30 seconds last month. We did have some issues last year with the pandemic because of the surge in new patients and such, and so some of our call times were longer. We really have that under control, I think, now. So everyone's aware, our call volume doubles between the last 2 weeks of December and the first about 5, 6 weeks of the year. So everyone in the company's been trained on phones, and we're really working hard to keep that call time down. But generally, we get all the calls answered very quickly. There is very easy enrollment. We just need basic information. If someone is connected with a clinic, the clinic can manage it and go through and monitor and order refills and everything. And we have pharmacists in every department. So we always want people to have the chance to talk to pharmacists. And a lot of folks mention that our pharmacists are great because they can take the time to speak with them, and it's more private than the drive-through or at the counter. So, and all the hours that we're open, our new hours are Monday through Thursday, 7 a.m. Central till 8 p.m. Central. Fridays we're open from 7 a.m. to 5:30, and we've just added Saturday hours from 9 a.m. until 2 p.m. Central. And you always have access to talk to a pharmacist about your medication. So we hope that that helps improve again the medication adherence. Are we taking the medication at the right time of day? It's after a meal or with whatever food. It's important that folks have access to pharmacies and their professional health guidance. So RX outreach, patient focused, transparent, convenient, and sustainable. Um, Sustainable is one we may not think about, but I bring this up particularly for our clinic partners. So we buy 85% of our medications, so we're not reliant on donations. We do get donations, and every month we have a newsletter and we have a free medication list, and that's what we get donated. And we pass that directly to patients that it's completely free. Some are bring down the cost of the medication for us, but others it's completely free. And we send that we publicize that only through our newsletter, or you can go to the website and search the price, and it may be free, but we always send it first through our newsletter. Our medications are not short dated. Everything we know our supply chain. We can track it. We have all our legitimate sources. We also have the state of the art technology. So we have an over 99% accuracy rate in our with our medication, which is higher than retail. And we have wonderful partnerships. So NeedyMeds, I got to give a nod to Carla and her team. NeedyMeds is a wonderful partner. When people find them, oftentimes they find us because of NeedyMeds. I think they're really our largest referral partner, and they're truly committed, and just we're honored to be associated with NeedyMeds. We also partner with the free and charitable clinics across the country. A lot of the volunteers in medicines organizations. I put this. This is not, if you're following on your slideshow that you downloaded, this one's a little bit different because I made a few little changes, but I wanted just to highlight the Hepatitis B Foundation for a sec. Um, a few years ago, um, two members of the Hepatitis B Foundation, they're in Pennsylvania, attended this very webinar. And afterwards, they reached out to us and said, hey, 20% of our calls this year have been, this is about March, I think, have been about medications. People can't find them, they're too expensive. Would it be possible for you to add some Hep B medications for people that we serve? And because of our buying power, because of being nonprofit, and a few other things, we were able to add, I think, 2 of the 5, and it was wonderful. So we got some wonderful donations, and just last week we announced that these 2 hepatitis medications are completely free to people that are coming that come to us through Hepatitis B Foundation, and that's I think they're $45 a month from us, but they're more expensive even at retail. So people are going to be able to get a lot of full year of this Hepatitis B medications. And so I bring that up because if any of you are on here from a disease state organization, or you want to kind of have a creative partnership, we're here as part of the healthcare safety net, and we just want to be able to help your patients. So please let us know if there's a medication that you want, or that for us to add, and if we can, we will. I get asked a lot about Elsevier. I can't think of it right now. You guys know what I'm talking about, I think. But we can't add as many of the brands. We can try, but we that's how we add medications to our formulary because people ask. So I want to go in before we wrap up here, just about a few of our kind of special programs. So we partner, as I said, with lots of clinics around the country and doctors' offices, and we have our preferred clinic program has different levels. There's no charge or anything. This is just a way to help our healthcare partners. So first is a tier program, and that is where the clinic actually pays for their patients' medications, and any patient that they send the prescription. We fill it and we invoice the clinic. Some clinics do this when they get grant money. Others just do it for some patients, but they send it in. There's no prepayment, and we can send it either to the patient or to the clinic. Another level is tier two, and that is where we manage the payment part of it. So they send their patients through and the prescription, and then we call the patient, reach out and get the payment, and then send the medication to their home. In the clinic programs, there's a clinic portal, and somebody can go through, they can order the refills, they can manage it all. And we do the customized reports. And this is the only place where we offer this a discount, and that's a 5% discount on all our medications for our partners, clinic partners. And some of those clinic partners through our clinic partners and other community partners, we offer this discount. Um, we also, we do all this because we want to help. We want to increase that medication adherence, and the literacy of folks with their medication, have access to the pharmacist. But when we get right down to it, almost $1,700 is the average savings for our patients each year. So we're very proud of that. We also, so you're aware, have a program called Serving Those Who Serve Others. This came about because of um, people here at RX Outreach that couldn't afford our medications, and we realized that people with other nonprofits and other companies, for people that may not have benefits, that RX Outreach could be a benefit. And so we do have partnerships with different companies. So if your company doesn't necessarily have a great insurance, or if you have a lot of part-time employees or volunteers, um, they can call us, and actually call me, and we can set them up as a Serving Those Who Serve Others organization, and anyone who comes to RX Outreach will be able to get that discount and get the help for the employees. So they have benefits for them and even their families. We also have a program called Healthy Reentry, and this is a wonderful program that was piloted here in Missouri, and has expanded now to other states, to Wyoming and Arizona. And it's for people getting out of prison. So when someone gets out of a jail or prison, they generally have 7 to maybe 30 days of medications, which isn't enough time for them to get to a doctor, a clinic, and have a continuity of care. And so our Healthy Reentry provides bridge medications, physical medications, and for mental health conditions, to people getting out. We work with the Department of Corrections. We work with the parole officers, some of the healthcare providers, to kind of fill this medication gap. And it's been wonderful. This is free to those people getting out, and we firmly believe that it helps reduce recidivism. It helps with public safety and the transition. Nobody wants someone moving into their neighborhood who just got out of prison and off their mental health meds. It doesn't make it easy for someone to get to a job and transition. So we're really proud of this program. And so I want to kind of wrap up here, and um, you know let you know that if you have more information, reach out to us. If you can refer a patient to us, or if you're interested in joining one of our programs, our clinic program, or the others, please let me know. RX Outreach is here to support our community, our patients, and our community partners. And we really need your help. I'm our entire marketing department, just one person. So your help is needed. Um, Other ways you can help is you can sign up for our newsletter, follow us on social media. Um, this newsletter we just send out once a month, and it's very simple by email. So um, if anyone has questions, I think we probably have a few in the chat, but it really has been an honor to speak with you today. And I do hope that you consider our outreach for our convenience, for our price, and really for a higher quality of life for the people, for you and the people that you serve. Thank you.
Bill, thank you so much for taking time to share your expertise and enthusiasm about RX outreach with NeedyMeds users. I'm always impressed. We've been partners for a really long time, and the thing that always jumps out at me is how much RX outreach has expanded. And you and the rest of the RX outreach team has really done that based on the feedback that you've gotten from your users. And as you said, RX outreach, every dime that they have goes towards their mission of making medications affordable and making them accessible to those that really need them. And sometimes that translates, as it does with RX outreach, as Bill said, he's it as far as marketing team goes. So if to attendees that have joined us today, sign up for the newsletter, spread the word to your patients, clients, use it yourself, or share it with your loved ones. Just spreading the word about RX outreach really goes a long way, and I'm sure Bill would mirror that sentiment. Sorry, guys, hang on one second. So here's the thing, as Bill said, we do have some questions coming in, and we're going to get to those in just a moment. In the meantime, I want to remind everybody that NeedyMeds also is here as a source of support. And as I mentioned in the beginning of the presentation, if you are looking for help affording your healthcare costs, and that can be something above and beyond medications, NeedyMeds is here for you. You can reach out to our toll-free helpline, and I'll have that number up at the end of our presentation. But you can also check out that healthcare savings tab on needymeds.org. And what you're looking at are those categories that you will find under the healthcare savings tab. I'm not going to go over these today. I just wanted to remind you of the breadth and scope of the healthcare savings resources we offer. Encourage you to check them out or give us a call. If you are interested in learning more about these, check out that calendar of events on the bottom right hand of needymeds.org. That's where you will see all of our upcoming webinars. We do try and do an overview webinar at least once a month, which reviews what all of these categories are and how they can help you. And you can also find webinars dedicated to specific healthcare savings resources. For example, we do have webinars about just patient or prescription assistance programs. We do have webinars dedicated to just diagnosis-based assistance programs. Of course, as well as how to use the NeedyMeds drug discount card. So keep that in mind. As we get to those questions that are coming in, and again, a reminder, you can type them into that question section of your GoToWebinar control panel. If we don't get a chance to answer yours, we will follow up with you by email. And as we get to those, I want to leave up the contact information for RX Outreach. You can also find my contact information and the contact information, including our toll-free helpline, on the bottom right of that PowerPoint slide. So let's get to those questions coming in, Bill. And all of the ones I see are it looks like they're dedicated to questions about RX outreach. So one of the first ones, and I'm pretty sure you mentioned this during the presentation, and this came in, I think, before you got around to saying this, but it's still a good opportunity to drive this home. And the question is can I use RX outreach if I already have insurance?
Yes, that's a great question. Absolutely. We don't take the insurance ourselves, but if you have insurance, you're welcome to use it. It is not detrimental in any way if you get your medications from us. You get one medication or multiple. The insurance companies don't care. So I think a lot more of our patients now have insurance and just find that it's still cheaper or more convenient with us.
Absolutely. And thanks for that question and the clear answer, Bill. We get that a lot at NeedyMeds is can we use your drug discount card if we have insurance? Or are we eligible for programs that'll help me save on medications if I have insurance? And the answer for a drug discount card is yes. You can choose to use the drug discount card instead of insurance. As far as our program goes, and I do see a question coming in about programs that we connect you to, it depends. It's on a case by case basis. So, another question coming in is how much does RX outreach cost?
Sure. So we do not have any membership fees. The only price is the price of the medication, and that is what's listed on the site. So we have everything kind of tied in with that one number. So that includes the dispensing, the cost of medication, the dispensing, verification by the pharmacist, and the free standard shipping. So all that is that's the only cost that someone will pay. In fact, some folks do just come in, they just get the free list through the newsletter and they get their free medication. That's it's as simple as that.
And it really is as simple as that. And I do hope that um, our attendees, do sign up to receive that RX Outreach newsletter. Um, there is an after the webinar survey that I believe that question is in there, but there's also a place for your comments. So please let Bill know any feedback that you do have, and also if you'd like to sign up for that newsletter. So another question coming in, and I think this is a really important question, one that I'm sure, like the other questions that you've gotten many times before, and it's simply, where do you get your medications? Are they safe?
Sure, they are absolutely safe. So we as a accredited uh, pharmacy, we report every day to all 50 states. We get surprise visits from boards of pharmacy, and we get our medications either directly from the manufacturer or through our group purchasing organization, and it's the same ones that the Walgreens, CVS's of the world that they get theirs. How do we keep our prices lower? Well, we're a nonprofit. We don't we don't spend very much on advertising. We save as much as we can, and that's how we pass it on. But everything is safe. We can track the supply chain from the manufacturer, all the way to RX Outreach.
Wonderful. Thank you so much. And I'm always happy when we get questions like that because that means that NeedyMeds users and the public at large are really becoming savvy when it comes to being healthcare consumers. And it's really important to ask questions like that. So thank you to our audience for participating. We do try to keep the question segment brief. So, as I've said a couple of times, if we didn't get the chance to answer your specific question, you can feel free to reach out to RX Outreach with at the contact information on that slide on your screen, or NeedyMeds, and the contact information is at the bottom of that screen. But of course, we will also respond to you via email. To our audience, I know it's a busy time of year, so thanks so much for taking the time to join us and learn some really important information about our partners, RX Outreach. We do hope to see you at future webinars. For now, thanks again for taking the time to join us. And Bill, thanks again for sharing your expertise with the NeedyMeds audience. Everyone, have a wonderful rest of the day. Happy holidays, and we look forward to staying in touch. Thanks, all.